This is our program, Perspectives, and this is Marides Fernando, your host for today. We have with us very, very important guest. Many people know her for what she has been doing in the many years of fashion designing. We have our very special guest, Jeannie Colburn. Welcome, Jeannie.
Good morning, Marides.
And we have a professor or a doctor in holistic medicine, Dale Flores, who will share with us how we in the Filipinos can help ourselves get cured from various diseases using natural food or natural medicine, to teach Filipinos how to cure themselves through natural food or natural healing. And they've started a store and is sharing with us, the Filipinos, on how we can cure ourselves from various maladies, even cancer, diabetics, and all these chronic diseases, which we ourselves can do using natural food or food that is available in the Philippines, saving us a lot of money. So, Jeannie, can you tell us a little bit, how do you cleanse a body, or how do you cleanse the organs of the body so that, you know, you can detox it?
Well, the body is composed of a lot of systems, particularly the immune system.
Mm-hmm.
And the immune system right now, especially in the last few years, have been popularized, even in the medical system, that it is the best way to get cured. Now, what we did was basically using food, we look at the causative factors of what's really happening to the body. Mm-hmm. What is interesting about the method is that you just allow the body to do its own thing, which is really, because the body is a very, very smart system. Mm-hmm. And if you allow the body to do what it needs to do, the healing is faster, so it's accelerated. And just gets rid of the toxicity inside, present in the body, which is causing the problem. And we've realized, especially in the last few years, with our clinical trials and our patients, that the body is capable completely of getting rid of the problem without having to resort to a lot of synthetic medication. Most of that diseases it's only the body can actually fix itself. If you're looking for the word cure, I think that's where it begins,
mm-hmm.
as soon as the toxicity comes out.
So, for example, in the case of Jeannie,
what we did, I think the best...
it is not normal to sleep 3 hours a day.
Right, it's not. And because people that are very work-oriented and are very overachievers, they tend to do that.
Yes.
And then so what we did was, I think the best example, I think, for everybody listening would be like a cell phone. If you're always running on low battery, or you're on your one bar, mm-hmm. you cannot, the cell phone cannot function. So is the body. So there's got to be a repair time. And so what we did was we just extended the amount of rest that she's getting, mm-hmm. and you know what? You don't pay for that. You just pay. That's rest. That's free. Sometimes just listening to the body and what it does can give you signs and symptoms that I need help. Right now, I think especially in the last 5 years, people are beginning to see that the Western approach is not the only way to go. Chemo is an option in radiation. But looking at the person first with the emotional side of it, I'm telling you this based on 10 years of experience in dealing with them, that if a person has a lot of baggage, let's say for instance, tough time forgiving and letting go, the cancer is very, very strong. But the moment the person starts to forgive, I can tell you one patient with a big tumor like this shrunk within 3 to 4 months. The moment the person starts to forgive. And
that's
this is
amazing.
Yeah, and this is not something that you can provide in a pill form. Mm-hmm. But that's one aspect of it. And then the second part is you look at the nutritional factor. There are a lot of food out there that if you have cancer will actually make your cancer worse, because it feeds the cancer cells. Mm-hmm. So these are the things that we focus on in looking at that approach. So for instance, that one person that was diagnosed with terminally ill and they only have 2 months, I've seen that person 7 years later with a better quality of life, and the person is still alive. So in terms of curing cancer, the cure is from within the body, and the person just needs to feel the trust that there is some sort of a hope somewhere. Not only educating the public per se, but also for those people that would like to lessen their medications. We have doctors that are also our own patients that have looked into the lifestyle. We are a lifestyle clinic, so we don't go against the medical system. It's just a support system, particularly for those, especially in lifestyle, that would like to are open for options.
Thank you very much for joining us, Jeannie and Dale. We've learned so much from your experience.